welcome to Season 2 of Food is Medicine. I'm your host Sunia Arash, and in this episode we will talk about headaches. I have Dr. Rafat Siddiq, CEO and President of WNY Medical PC and a physician with over 30 years of experience. Welcome, Dr. Aras.
Thank you for having me.
Thank you so much for being here. Before we go further, let's watch a short clip about headaches, then we will talk about it more.
Headaches are very normal these days among people. Here are some reasons of headaches: excessive alcohol intake, having stress and anxiety, skipping meals, having cold or cough, lack of sleep or poor sleeping posture.
Welcome back, everyone. I hope you found the clip helpful. So, Dr. Aras, what are headaches in your point of view?
Headaches are, as everyone knows, like having a pain in our head, and it's like sometimes it's all over the head, and sometimes it's only one side or back of the head, front of the head, and it's a very common complaint people come with. And it's sometimes very annoying. People cannot concentrate on anything. So though it's a simple thing, but it can be a very complicated thing.
So what causes the headaches? Or in another word, why do people get headaches?
Okay, then there are some simple reasons, and as we say, food as medicine. So some foods are very important. And number one item on our food is water. So if we are not drinking water enough for our daily requirement, we will start having headache. And sometimes that's a simple reason. So especially in winter, when there is a heat is on, people don't pay attention and they will start having some dull headaches. So that's number one. So we have to be very, very careful with our diet. What we are eating. Sometimes people who are having low sugar, they are dieting and they are not paying attention to their food. They want to look good, so they don't eat properly. Yes, they can eat less, but they have to have the proper sugar level in their system. So if you have low sugar level, you will have the headache. Then sometimes if they are having a lot of salt, people take a lot of these chips and which has a lot of salted almonds, salted things. They will actually have a lot of, because salt and sugar retain water. Now you have too much water in the system and you may have blood pressure, and that also can cause the headache. So the headaches can be also a symptom of many other things. So I told everyone the food items and how that can be related to the headache. The next can be the stress. Sometimes people are having anxiety and depression, or at work they are not performing well, they get stressed and they get headache, and then they perform even again poorer and poorer. So it's a vicious cycle. So stress of any kind, at work, at home, family, friends, any stress. So headache is one of the symptoms of our problem.
Well, can you talk about migraines?
So migraine is also a type of headache, and it actually has some, it's a specific type of headache. It sometimes gives you warning signs, sometimes noises, extra light, or again stress, some food item. Some pre-menstrual girls can also have the migraine. So certain time of their menstrual cycle, they will get migraine. So it can be related to the hormones. When we get migraine, there are sometimes people can get sometimes simple headache, but sometimes they can also get the visual problem. They can have nausea, vomiting. The symptoms can be even worse, but sometimes in men they get cluster headaches. So only one side of the head will be really having pounding headache, and the treatments are different. cluster headache, the main treatment is go and get some oxygen. Your headache will go down. But I must say that people should see the doctor if they are having headache, because one time there was a patient, I can share that with public, how important the headache is. Headache can be a symptom for very serious problems like brain cancer. So I had a patient who came to me and she was having headache, and I first watched her for a couple of weeks. I said, oh, well, maybe I went through all the things, the diet, the stress, any medications, everything. So she did not fit in any of the category. So I said, I want to have now the CT scan of your head. I had a CT scan, and here she had a brain tumor. So yes, headaches can be simple, but headaches can be very complicated. So do not take this so simple. If you are having constant headaches, please go and see your doctor. Maybe there is something serious. Maybe your sugar level is low. Maybe your sugar level is high. Maybe your blood pressure is high. My mom used to get the headache back of her neck, back of her head, and her blood pressure will go up. And she will say, I am having my high blood pressure. I said, Mom, how? And I was younger at that time. I was not even a doctor. So she would say, I have a high blood pressure. And I said, how do you know? She said, I'm having headache. So, and she was very smart. She would just, before even she checked the blood pressure with the blood pressure apparatus, she would say, give me my extra pill. So I remember she would take an extra pill, and when I would check the blood pressure, yeah, it was 160 or 100, and so she was very smart that way. So please do not sleep on it if you're having headache. Sometimes people are having headache because of the vision problem. This is very, very common. People are having problems if their vision is not perfect. So please see the doctor, and then please see the eye doctor also. So these are serious things. So it's not very simple symptom.
Oh, very well. Is there any way to reduce headaches?
It depends what is the cause. Like if the cause is stress, now we have to fix the stress. We cannot start multiple medications for headache. If I know that if I'm at work and I know I have a lot of stress, I know my job is such that I do get a lot of stressful things, and I do get headache, instead of popping up the pills to reduce the pain, I should work on the stress. How can I deal with the stress? So can exercise help me? Can my counseling help me? Can other things help to reduce my stress? So that's stress. If a headache is because of the dehydration, then we need to drink water. If headache is because of the low blood pressure, we need to drink water. And also we should eat those things which can give us good volume of our blood, and we will not have the low blood pressure. If our sugar is up and down, we have to work on it. If we are having migraine, we have to work on that, how we can avoid the noises, how we can avoid the lights, or how we can then talk to the doctor. They will guide you how we can. So this is a symptom. So we have to treat the cause instead of popping up all the medications, because all these medications have side effects. Sometimes people get used to getting those medications which are addicting. So we have to treat the root cause for headache.
Oh, very well. Thank you so much for all information and helpful tips, Dr. Rifat Siddiq.
Thank you for having me.
Thank you so much for watching. If you like our video, please like and don't forget to subscribe to our channel.